This is a Doc Talk podcast short with Dr. Jenna Burton and me, James Piecowye.
Less seasonal, but we always get gastroesophageal reflux disease, and I'd say the flu and GORD are just like
they're bread and butter business. It's bread and butter.
I'd say at the moment, yeah. So we're getting a lot of people that have got not even really many risk factors for gastritis, GORD. And what I'm talking about here is inflammation of the stomach, making too much stomach acid, having that stomach acid ride up into the back of the throat. So actually what a lot of people present with is a cough. And they're convinced there's something with their lungs. And they say, I've got this cough, but it kind of feels like it's coming from here. Sometimes it's more choking. I get this cough really badly over nighttime when I lie down or after I've eaten. And then you start exploring and you listen to the chest. It sounds clear. You say, do you drink much caffeine? Maybe they do. Alcohol, Smoking, stress, big one, or anyone been diagnosed with H. pylori infection, which also causes gastritis.
What is that? H. pylori infection?
Yeah, it's an infection that kind of lives in your stomach, causes too much stomach acid. Big cause of ulcers, gastric or duodenal ulcers. And and it's something that you can catch, needs antibiotics, but doesn't always get diagnosed properly. So we get a lot of people with these things, and then you say, actually, the problem is not your lungs, the problem is your stomach, and then the acid that's meant to live in the stomach can come up into the esophagus and cause this coughing because the acid is not meant to be there. We're not meant to have acid on these more sensitive cells.
Wow. And this is pretty common?
Very common. Very common. Think about Dubai. Gosh, indulgent lifestyle. People are having big meals. We're generally creating too much stomach acid. James, I might have to just pause 1 second.
Yeah. Do what you got to do. Stuff falls when we're podcasting. We're all over the world here. It's.
Hello, Jenna speaking.
Oh, she's taking a call. Okay, hold on. I'm going to put you on pause. I'm going to.
Just ring the bell, and you can even.
This Land Rover, huh?
Yes.
Oh, okay, man.
Thank you. Bye-bye. Bye.
Welcome, bye.
Sorry, James. I always panic. It's the school because they kept ringing and I was turning it off,
okay.
And then they rang about 5 times.
Okay.
But it was one of Glenn's guys. Sorry.
Yeah. It's okay. It's okay. Got to do what we got to do. It's easy.
It is. Are we still going?
Yeah. I'll just edit this out. Don't worry.
Okay,
I'll make a note. I'll make a note. Well, anyway, I always watch it all anyway, so it works fine.
Sorry, James.
Yeah, that's okay.
Okay, so where are we up to? So obviously in Dubai we have super indulgent lifestyles. People have big meals, quite fatty meals. People drink a lot of wine or any other alcohol. You always see people with their coffee cups, and because they're worried about their weight, they might have just black coffee. Less smoking. Some cultures, I'd say, are more inclined to smoking than others, and it's a super, super stressful lifestyle. People are away from homes. I see people that have got family members back at home that are unwell. They're struggling to keep down their job, but they have to keep this job because it pays the school fees for their children, or they're just crippled with financial strain from living here. The cost of accommodation has gone up. Schooling is, James, goodness gracious, it's very expensive. Yeah. There's a lot of things to juggle. And so stress is a huge, huge risk factor for gastritis, esophageal, and sort of GORD. GERD it's called in America because they don't use an O in the word esophagus. So it's exceptionally prevalent and something that does need to be managed. If you leave somebody with ongoing gastritis, it can actually start to erode a small hole in their stomach effectively.
Really?
It can cause an ulcer. It can cause bleeding. If somebody has black tarry stools, or they even vomit and they have like a black vomit or a fresh red blood vomit, these are definitely reasons to go and see your doctor, and usually 9 times out of 10 will involve a referral to somebody like Dr. Neil, a gastroenterologist, to put a camera down and see what's going on.
Wow. This is when you said, hey, we should talk about gastro and acid reflux and gastroesophageal reflux disease.
Well done, James.
Yeah, I almost got it there. I started looking at this and I thought, is this really happened? And now I'm actually listening to people, and I hear lots of people kind of that with for no good reason. I'm thinking that might be reflux. There might be a reflux issue going on there. And people,
it's one of the main causes of a chronic cough.
Okay, there we go. And I hear a lot of people with chronic coughs, and not really big ones. Sometimes just the all the time, like they're constantly doing it. It's like, got some issues you got to deal with.
You'll find that the cough's worse after eating and sort of first thing in the morning as well, which is difficult because when somebody has a smoker's cough, which is trying to remove secretions because the little hairs on the linings of their lungs stop getting rid of mucus.
Is part of the problem when we start thinking about this?
Sorry, it's just my nurse coming in to say hello and see you, James, probably.
Oh, hi. Is part of the
Everyone
problem,
wants to get in on the podcast.
I know. Is part of the problem that when we're treating sort of acid reflux things, we're not necessarily, as the patient, thinking about the bigger picture, and we're taking an Eno, or we're taking some other thing that's going to help with acid reflux, but not treating the big picture, and we're not dealing with the big picture. We're just masking things.
I think what is very common is that people will take the pills to reduce the acid. Right. And as you say, that is a band-aid because it doesn't really get to the crux of the issue, which is why have I got acid reflux in the first place? But the problem is, if somebody has significant stress, how easy is it to just remove stress from your life? It's something that everybody should be working towards, of course, but it's not always that easy to do. Yeah. So yes, you must take the medication if it's prescribed. You must get to the root cause, establish why it is you have acid reflux, because there is usually a reason. It could be obesity, it could be foods or drink that you're consuming. It could be, as I say, stress, or it could be an infective cause such as H. pylori. But there will be a reason. So find out what that reason is, so at least you can get on top of it. Yeah. And then take the medication, but then don't just think, right, well, I'll stay on the pills forever. The tablets for reflux and gastritis, the problem with them is they can often cause deficiencies in vitamins. They can cause a bit of malabsorption. They can mask the symptoms of stomach cancer. They especially renowned for causing vitamin B12 deficiency. Then people need to have a vitamin B12 jab sort of on a regular basis going forward for the rest of their lives often. So they're not without their side effects. Yeah. So do get to the bottom, and if you can treat the cause, better, because then you might just need the tablets for a short time, let everything settle down, and then you'll be free of symptoms, hopefully, without taking anything.
As you were saying, our diet is an issue. Yeah. Smoking is an issue. If you're drinking alcohol, that's an issue. Lifestyle. We're talking lifestyle change here.
It's a lifestyle. It's a disease of lifestyle, I would say, and hence probably why it's becoming more and more common.
Which is a huge problem because we've got stress. So what do? We head to our comfort foods, and a lot of times it's